Hello, today I'm going to be giving furosemide by IV Stat. We have our primary line going here with a incompatible solution. So the first thing I'm going to do is start with my 7 medication checks. So to start, I've got patient teddy bear, furosemide, 40 milligrams IV push for 2200. And our reason is for fluid overload. And then we have our medication here in the vial, so I'm just going to check this. Furosemide, 40 milligrams, and this is 10 milligrams per ml. So I'm just going to do my dosage calculation here. So order is 40, divided by what's available is 10 milligrams in 1 ml. So that gives us 4 mils. Okay. So that is our first medication check. So the next thing I'm going to be doing now is drawing up the medication. So I've got my syringe here. And I'm going to be using a blunt filter needle because I'm drawing it up from the vial. So again, sterile technique, twisting it on. And I'm going to alcohol swab the vial, 15 seconds in circular motion. Let that dry. Now I am going to take the needle off. Again, I'm drawing up 4 mils, so I'm going to inject 4 mils of air into the vial, and this just creates a vacuum effect. Now just using a sterile technique, not touching the plunger. Now again, drawing up 4 mils. Again, just making sure I got my 4 mils here. And it's going to get rid of the air. And once I have my 4 mils, I'm just going to cap it again with one hand. And then I got my lid on, and then I'm just going to take this off the filter needle because I don't need it anymore. Now I'm going to do my second medication check. So this time I'm going to fill out my sheet for the needle here. So our patient name is Teddy Bear. And again, comparing with MAR is furosemide, 40 milligrams, and that's 4 mils. So again, we have 4 mils. 4 mils. The time, 2200 we'll give this at. And the reason we're giving it is fluid overload. And then also, I'm going to check the parental drug manual. So when I check the parental drug manual, we're giving it IV direct. It says I can give it a max of 40 milligrams per minute, and that is equivalent to 4 mils, the 40 milligrams. So that means I can give 1 mil per 15 seconds. So on my vial, on my syringe here, I'm just going to make a line just for 1 mil, 15 seconds, 2, 15, 3, 4. And then also too, we do have a doctor's order for the furosemide. So I'm just compared that with the MAR. So that is our second medication check. So now I'm just going to gather my supplies, or I'm going to put my actual sticker on the syringe here. I've got my two normal saline solution to prime the line. So I'll just put that beside the patient. I've got my MAR here that I'm going to bring into the room to compare. I've got my furosemide. And then I'm going to do some hand hygiene before I go into the room. And then, yeah, so I'd also put on some gloves. So now that I'm in the patient's room, I'll introduce myself. Hi, I'm Natasha. I'm going to be helping you today. We're going to be giving you furosemide. Do you know what furosemide's for? No? So this is for fluid overload. So it's going to help you get rid of all the water in your body. Some pre-assessments I would do would be assessing for edema, blood pressure, daily weights. I also would look at their renal function on the labs, their electrolytes. Since this is going to get rid of all the fluid, the electrolytes can go with it. Now I'm going to do my third medication check. Can I see your wristband, please? So you tell me your full name and your date of birth. So 2 patient identifiers. You can also use the MRN as an identifier. Do you have any allergies? No? Okay, now I'm going to just do my third check with the furosemide syringe here. So again, furosemide, 40 milligrams. I've got 4 mils drawn up, and that's our 4 mils for our dosage calculation. The time is 2200, and the reason we're giving it is fluid overload. So that is my checks. Put that here, and again, I'm also doing this 1 mil every 15 seconds. I have it on my syringe. I also have my timer in the room. So I'm just gonna set my timer here. This is stopwatch. Because the solution is incompatible, I would stop the Alaris, but in this case, I'm gonna close my line here. All right, so now that that's stopped, I'd ask my patient just assessing the IV site. I'm looking for any infiltration or phlebitis, so any redness, any swelling. Ask the patient if it's been bothering them at all, if it's been painful. Okay, now I'm just gonna prime the line. So I'm gonna take my alcohol swab here. I'm gonna close it off using the port closest to them. Circular motions for about 15 seconds. Okay, keeping it clamped. I want to let it dry. I've got my solution here. It's already been primed. And then this is just checking for patency, and then also, again, it's incompatible, so I'm just clearing the line. Twist that on. Again, just making sure I don't touch the plunger. So this, I'm just, again, just making sure it's patent, clearing the line of the solution right now. Just talking to the patient, how are you doing today? Also let the patient know of the side effects. You could have hypotension because you're gonna get rid of the water because this is a diuretic. You could have like a headache or any dizziness. All right, uncap that. This one's empty. Now again, another alcohol swab, keeping it clamped, 15 seconds. And then just letting that dry. Now I have my furosemide here. And again, it's 1 mil every 15 seconds, and we'll do the stop push method. Okay, so I'm gonna hit my timer here. Okay. Okay, 30 seconds, another 2 mils. Go down. Okay, and then stop again. Now at 45, and we'll do the last mil. And that's a minute. So that's all of it. Twist that off. And now we're just gonna prime it one more time. So again, just wiping it with the alcohol swab, circular motions for 15 seconds. And then just letting it dry. Now we'll use our second primed normal saline. And we got to do it at the same rate as the medication. So again, I'm just going to reset my clock here, my timer. Again, just slowly injecting 1 ml per 15 seconds. So push 1 ml, then stop, that's 30. We'll do another ml. Just checking the patency. All right, 45 seconds, and we'll do 1 more ml. And then we don't have to do all of it. We can just do the 4 mils, just like we did the 4 mils of the medication. And that's a minute, and I'll just unlock that. Okay, and unclamp this. Again, just assessing the IV site, asking the patient how they're feeling. I'd stay with the patient to see if they have any side effects. I'd dispose of my syringes in a box here. I'm going to take off my gloves, dispose of them, hand hygiene. Again, just staying with my patient, seeing if there's any side effects like I mentioned earlier, any hypotension, dizziness, or any other adverse reactions to the medication. Okay, and then I could restart the line again here. So I'll just unclamp it. Just looking for that drip. Okay, now I'd leave the room, sign off on the medication I gave. And then if I had any concerns, I'd notify the healthcare provider. Again, my patient has their call bell within reach, and they could notify me if anything, and then I'd go back in and check on them. Thank you.